The vibe in the faculty is kind of not just producing doctors, but I feel like it's kind of producing happy doctors and social doctors and people that are good with people. I think they try and make people that are good doctors, but also good speakers and good listeners. And I think they have a big emphasis on those things, whereas maybe not as much in other places. The first time I was doing group work was sort of in my foundation year, and kind of going into it, I wasn't really sure how it was going to work. We didn't really do much group work in sixth form, but I very quickly found that it's an interesting dynamic because you get people that really want to do a lot of things and be very like type A personality, leader people, and then they have people that don't really want to do anything, and then most people are kind of in the middle, and you have to try and figure out what everyone's strengths are, weaknesses. And I think I learned a lot from those experiences of working with groups and working with other people. The first time I did placement was in my foundation year in BM6, where we'd have placements that were different to kind of the GP placements that you have in the later years. So in these placements, we'd be in a GP, but it was much more kind of, we were observing and we were listening and trying to understand more the dynamic of doctor-patient. And then obviously, as you go into BM5, you do the mid placements, which are more kind of understanding how to take histories and you're starting to get the clinical skills. The placements were actually like the most fun part of medicine so far for me, because it might sound a bit cliche as well, but like you do medicine to be there in the room talking to the patient, doing things. And so it's kind of the first time you get the feeling of competence in any form. So that was a really good feeling for me. But it's also quite nerve-wracking, I think, as well at the start, because you're talking to other people and you're kind of acting like you know what you're doing, but you might not really know what you're doing. So yeah, it was an exciting kind of nervousness, but it was really fun. You might wonder, like, what's the point in doing research when you're trying to become a doctor, you're trying to learn clinical things and how to fix people. But I think research is super important because, first off, as doctors, I don't think we just have a duty to care for patients directly, but also we need to make sure the community is moving forward in terms of health, and if you can produce methods of helping people not have to get the treatment, then that's surely a better outcome than waiting for them to come in and be sick. So I think it's a responsibility that we have to do research. But also I think it develops you a lot more in terms of speaking with other professionals and understanding how to kind of lead your own project and manage your own time and manage your own kind of work. So I think that's the point of the research. It's to develop you as a person.